1FM 91.3, Good Times, Greatest Hits. What a great song for a Wednesday morning. It's Tony Basil and Mickey. But it's not Mickey in the studio today. It's Dr. Poon Kee Hwang that we're welcoming. Please join us and welcoming this very special guest from My Braces Clinic.
Yes, dental specialist in orthodontics. She received her orthodontic master's training at the National University of Singapore with dual accreditation from the Royal College of Surgeons, Edinburgh. And as a braces specialist, Dr. Poon has helped shape the beautiful smiles of many patients, changing the lives of so many by doing what she loves. And she's here to talk to us about the orthodontic issues with our teeth and jaw. Let's welcome this extraordinary doctor and a dear friend of mine, Dr. Poon Kee Hwang.
Hey.
Thank you, everybody. Welcome. Good to be on the show.
Dr. Poon, really good to have you here with us. And I guess the first thing we want to know is, how did you get into this profession, and what do you do to enjoy most? What do you enjoy most of what you do?
Okay, to be an orthodontist, well, you first need to be a dentist. I mean, just like cardiologists, they all start off as medical doctors first, right? So you have to be a dentist first. So you need to get yourself into a dental university. And in Singapore, that takes 4 years of studying, right, in a university program. And after that, you graduate. You need a minimum another 2 years of working experience as a dentist. And you study at the same time qualifying examinations to apply for a master's program in orthodontics. And then you study another 3 years full-time in a postgraduate program. You graduate with a master's degree, but still you need to, clock cases, work with the Singapore Dental Council, take their qualifying examinations, pass it, to call yourself an orthodontist. So from beginning to end, starting university and being an orthodontist is going to take about 11 to 12 years.
Wow.
Minimum.
The master's alone was 3 years.
Yes, correct.
Wow, you got to brace yourself for a lot of stuff.
Very good.
Sorry.
Yeah. I got that.
We can't help ourselves, Dr. Kee. You're such a fun person, or Dr. Poon. Can we ask you, what are some common orthodontic issues that you do come across, and how can this actually impact a person's life or health?
I think one of the most common ones would be, my teeth are very crooked, so messy, just no space, right? So it's overlapping, it's so hard to clean. So when you get food stuck and, you're more at risk of tooth decay, gum disease, it's very hard to clean. So even gum disease alone is an independent risk factor for heart disease.
Yeah.
And if you have to have expensive treatment to repair the damage just to keep it, it's not worth it. So a lot of times patients come to see me because they just want to tidy up, make it easy to clean and look good.
Right.
Yeah, so that's one. The second one might be the protrusive teeth, the one that sticks out, right? So when it stick out, it doesn't look quite good, but it also increases your risk of dental trauma if you fall. So let's say if your front teeth stick out by 6 millimeters. Studies have shown that if you fall, it's going to be 4 times more likely to break a tooth.
Whoa.
If you have front teeth, if your front teeth that stick out, could it be your lower jaw is too short? And then when you have a very short lower jaw, you are actually at risk of OSA, obstructive sleep apnea. So you snore a lot at night, you wake up a couple of times because you cough and trying to get air in. That actually is a chronic and serious medical condition that needs to be treated.
Right.
So sometimes we work with ENTs, orthodontists work with jaw surgeons in order to correct this underlying jaw problem.
My son, who's now going to turn 11 shortly, had the jaw, which was obviously not prominent enough, I guess. I'm not sure if I'm using the right term. And his teeth were sticking out.
Right.
So he has twin blocks, which is which obviously you know very well, to try and get the jaw growing and aligning it properly, and also then helping to push the teeth back in. But we didn't realize, the orthodontist said, look, if it's doesn't work out, jaw surgery is an option.
Yes, correct.
And that got us like, oh my God. So we went, obviously, this non-invasive approach, which was twin blocks, which is to sort of align the mouth. But it's quite common. I guess it's fairly common with this problem with the jaw.
Yes, it's quite common.
Yeah.
But
what is that called, actually?
That's called growth modification or dental facial orthopedics, which is the long word.
Yeah.
Right.
The thing is that we are
DFO. We say DFO in the business, right? No, I don't know.
In the business.
That I don't know.
Duty free.
Okay.
Sorry.
I learned a new thing.
No, just kidding.
So the thing is that we
Yeah.
want to time treatment. We don't want to miss the boat.
Yeah.
Because certain things like what your son is doing can only be done at a certain time in their life.
Yes.
If you miss it, then so sorry.
Then it might
Yeah.
have to be surgery.
If
Right.
you want that type of facial change.
Yes.
If not, then if it's a malmoderate, that we just use braces to bring it in.
We're definitely going to have more questions for you. We're going to take
Sure.
this conversation to our Facebook Live. Come and join us, everyone, at facebook.com/1FM913. And hey, chime on in with your questions. I know you have them. And it might just win you this amazing prize from Uniba. It is the world-class dermafiller facial that's worth $299.
Back with more of Dr. Poon in a bit. Good morning, everyone on
Hey,
Facebook.
morning.
Hello.
Joyce wants to say hello to Dr. Poon. Joyce,
Joyce.
how?
Hi, Joyce.
Yeah, it sounds like you're friends. I don't know. Are you friends?
Hey,
Joyce,
are you?
how?
Are you?
All right. So, Dr. Poon, thank you once again for joining us this morning. I'm sure there are lots of questions that people want to know about what exactly it is that you do. I mean, the thing about gum disease and health, heart health,
Yeah.
that always surprises me. What, again, is the correlation?
There are many studies out there, but I guess the best person to discuss this with would be your periodontist or your dentist that deals with gum health.
Okay.
So as an orthodontist, my job is to move teeth and bones and really look at the whole face in total to get the right look for health and also for beauty. I mean,
And also for beauty.
And that's fine. I think that's fine. So what are some myths that people have about orthodontics?
I think the first misconception would be baby teeth don't matter. Not important. Well, it's going to drop out anyway. So if it's decayed or if it's broken, just chuck it out, right? Because it's going to be replaced.
Yeah.
So a lot of times, by the time the kids come and see me, they've taken out the tooth too early. The adult teeth are not ready to come in yet. So the surrounding teeth just, any old how kind of move and eat up that space. So you have severe crowding because the next guy can't come out. So there's much more difficult and more complex work to do. So baby teeth are not just cute to look at. It's important to hold the parking lot for the next guy.
Like a placeholder.
Yes.
I like that. I like that.
So I'm going to come clean, okay? She was my neighbor back then when we were all living in Chit B.
Okay.
And she's also our family. We go to her clinic. I wouldn't say she's our family dentist. She's our family orthodontist. And we go to her clinic. So you have this thing. It's very cute. It's called 7-Eleven.
7-Eleven. Yes.
You have
Right?
snacks in your...
No.
I would like snacks.
So 7-Eleven is basically the age where the first one is 7 years old because that's the critical age where kids should be screened for orthodontic work or problems. That's the age that's recommended by both the American Association of Orthodontics as well as the Singapore Association of Orthodontists. And that's because adult teeth are coming through, the face is developing, and if orthodontists, we need to jump in for urgent matters, the baby teeth are not shaky yet. I have time to get work done before it's too late. Then you got to wait it out until adult teeth come in. So 7 is the first milestone. Then it's 11, right? Because 11 is when the canines or the long tiger teeth are coming out. It has a very long and high path. It tends to get a bit lost.
Okay.
So 7 and 11 are two key milestones for kids to be screened by an orthodontist. A bit like, every time you go to 7-Eleven, you think of me, ding dong. Dr. Poon says, 7-Eleven must check.
That's how I remember it for my kids to come in and see you.
Yes, that's
Yeah.
That's the first time I'm hearing of this.
Now
But
you
I'm
know.
also wondering if that's why in primary school we had that many checks. You have the dentist van that
Correct.
comes along, the mobile dentist, and they are actually checking on you. And then there was one particular year where I felt that they came in more often than others.
I see.
Yeah.
Well, I think the Singapore government is doing a very good job to really ensure that our kids are well taken care of. So regular dental checks by the school service is to really check for dental problems, decay and gum problems, but they are also trained.
Yeah.
So if they see an urgent orthodontic issue, they will refer it.
Yeah, that's great. Shehzad?
There are so many new techniques in straightening teeth. I mean, a lot of people grew up with the old train tracks.
Yes, correct.
Right, but there are, I guess, more aesthetically pleasing techniques now. Right. Tell us more about that and how do we decide what's right for us? There's also adults. We spoke off air earlier about you can be any age and do
correct.
it, and then you do it for little kids as well, right? 10 or 11, you start doing it. So tell us about these techniques.
Okay, so it's really not about the technique or the product first. I like to plan with the end point in mind. So what does the patient need? Does the face need to soften? Does the lip profile need to change? What type of tooth movement am I looking at to get the results that I want? Can I avoid taking out teeth?
Okay.
What do I need to do to avoid taking out teeth? So all these needs to be factored in first. So it's like booking a Grab taxi, right?
Right.
So you know your start point, right? You know your start. But what you do next, you input the destination.
Okay.
Only then you choose the car or the type of braces to get to your end point.
Right.
So you wouldn't necessarily choose an F1 car to climb a mountain, and you wouldn't choose a 4-wheel drive for an F1 track. So different braces, different cars have pros and cons. So you need to choose and discuss with your orthodontist to see what works best. What will you enjoy wearing on a daily basis? Like you said, there are aesthetic options now, so choose something that you enjoy wearing every day.
Is it obvious to say that most people would rather have that new sort of technique, the more aesthetically pleasing one, or that people would say, give me the train tracks, no problem?
There are both. Why? It's because there are aesthetic reasons that you can't hide, just like how people choose a 5G handphone, right? But there are some people who say, you know what, I'll still use the landline.
Okay,
it's not wrong, but what will work for you on a daily basis, that's what's more important.
Okay, fair.
Yeah.
Okay, thanks so much for that. We're just going to be heading back live on air as well to address some other issues that you deal with as an orthodontist. I think, for some of us, we're still quite unfamiliar with this field. I don't have a family orthodontist like Lavinia does. And I don't think I've ever had to get referred to one as well. But I think now, especially after talking to you and about teeth straightening and all that, we do need to clear some.
It might be a good thing you haven't been referred to an orthodontist.
Yes. Right? Not something I'm worrying about exactly. All right, hang tight. We're heading back on air. .3 Good Times, Greatest Hits. Lovely sounds of Starship this morning. Nothing is going to stop us now. Thanks so much for having us on here with the Brightside. Carol, Lavinia, and Shehzad, joined in the studio by Dr Poon Kee Hwang, the dental specialist in orthodontics at My Braces Clinic. Welcome, Dr Poon.
So we want to find out more about this whole area of orthodontics, because I think not many people are very familiar with it. They go like, oh, isn't it the same as a dentist? But can you at least tell us, what are some of the a way for orthodontics, and the moving of teeth that happens, that can shape and change a person's face shape? Let's start with that.
So sometimes patients don't realize that when they have teeth that are messy or crooked, they have teeth that are out of place. So when they bite and they chew down, they unintentionally hit on a tooth that's out of place. So their jaw shifts to a side and the face doesn't look quite right. So by orthodontics, we move teeth back to their correct position, things fall into place. Hey, the lip profile looks better. The side profile looks better. So it really begins by studying the problem in the beginning and the end point, and then we formulate a plan, a strategy to get from beginning to end. So you can actually modify or change how you do. Example, if somebody has a very short jaw, right? We need to think about how we can disguise it. Example, not everybody wants to do jaw surgery. Some people may have missed the boat for growth modification. Then we can use braces to kind of disguise that.
Okay.
I like to use the example of me wearing black. I look slimmer underneath same size.
So that's why I love her.
She's a woman of mystery. I like her, Dr.
No,
Poon.
her analogies are just hilarious. And totally makes sense.
True.
It makes sense. That's why I love it. Yeah.
Hey, Dr. Poon, what if you're constantly chewing down on food and you find that you're biting your inner cheek a lot? Is that something you would look at as well?
For sure. I mean, who wants to live in pain?
Yeah.
I love my food. I really do. So if I'm going to eat and feel pain all the time, sorry, cannot.
Yeah. I end up with ulcers in my cheek because, for some reason I just end up like chewing my cheek. That's not normal.
That shouldn't be. I mean, life is beautiful, right? We need to eat and enjoy. So if that's causing you pain, get it checked out. I really think you should.
Okay, really?
Yes.
Yeah, I thought it was just me being careless, but then it keeps happening over and over.
Sometimes if the tooth is in the wrong position, then it keeps rubbing, isn't it?
Yeah.
Then you have to think about how we're going to solve that, because food is so important.
Actually, speaking of moving teeth, that's a common misconception people have in general about teeth.
True,
and you spoke to me about this, that your teeth are constantly moving. Your jaw is constantly changing throughout your life. Can you talk about that?
I think one thing to remember is that we're humans. Every part of us is connected, all of us. With time, we age. Things move. Nothing is cemented in stone. So a common misconception is that, okay, I've done my orthodontics. It's finished. So all the teeth cemented in stone. Never move again.
Yeah.
Sorry, no. Not true. Okay, sorry guys. Because we are always eating, we're laughing, we're, moving our lips around, cheeks around, tongue around. There's always going to be constant pressure. So teeth will move ever so slightly with time, which is why you need to wear a retainer. Retainers after treatment is a maintainer. Retainer, maintainer, get it?
Yeah.
Retainer, maintainer.
Wait, right? I got something for you for that. Okay.
So it's very important to talk about the retention phase because it's almost as important as the treatment. Right? You don't want to work work your butt
through all
off,
the pain
exercise and lose so much
Mm-hmm.
weight, and after that, eat whatever you want. You have to think about the maintenance as well. It has to be sustainable.
Okay.
But not everyone needs it, right?
Retainers?
Yeah.
I
after
would
a
say
certain age.
most. Okay, not really. If you want to keep your teeth super straight for life, you should consider having a retainer for as long as possible.
Goodness.
For as long as straight teeth matter to
I
you.
do.
Oh.
So I use Invisalign. And up
Right.
till today, my very last pair are my retainers.
Yes,
And
exactly.
I use them every
Just
night.
wear them to sleep. Pajamas for your teeth.
Oh
Yeah.
gosh. Okay, so not in the day, you don't need them out. Depending on the severity?
Yeah, just like when you put eye cream, right?
Yeah.
At night. Right. Face cream, right? Moisturizer. You want to maintain.
Oh my
So
gosh.
retainers are
I
maintenance.
didn't know that people know this.
Yeah. I don't.
Yeah.
I know you don't put eye cream, right? You don't need it.
The eye cream, no, I don't. To be fair, I don't. But
my
a retainer at night, that's
Yeah.
interesting.
Okay.
I've
I'm
never
not
heard
sure
of that.
people knew that. Yeah. So you're saying,
Yep.
really, ideally, if you want to kind of maintain your teeth and the shape and the way it's you want to keep
should be. Yeah.
Yeah.
wear a retainer at night.
Yes, consider it pajamas for your teeth.
I like
Oh
that.
my goodness.
Hold
Where
your
have I
teeth
been?
I
Hold
also
your teeth straight and
because I'm a
protect.
grinder apparently.
Exactly. Hold your teeth straight and protect your teeth. Look, a retainer that's damaged is way cheaper to replace than your teeth.
Oh goodness,
Very
she
good
makes
point.
a very good point.
Yeah.
That was a wake up call for me.
Hey, better you know it today
Yes,
than
correct.
to go through life without knowing it.
I was 2
Yeah.
years old when I discovered
Yeah, so
you need a
like
retainer
your
every
point,
night.
my retainer actually helps to protect my teeth because I
Yes,
do
correct.
grind my teeth.
Yeah,
a
we were
little
just
bit.
saying. Yeah, that's the
Awesome.
grinding
I
thing.
think we're all
Awesome,
teeth
awesome.
grinders here. Like, so I have bruxism as well that need to be checked. Oh my goodness, Dr. Poon, where have you been all our lives?
She's here. She's here.
Thank you so much for enlightening
Thank you
us.
for having me, that's for sure.
Okay,
Yeah.
it's been a great chat. Hey, if you have any questions, join us on Facebook, and you can also WhatsApp your questions to us 88550913. Dr. Poon, where can we find you? Actually, My Braces Clinic. You have 2 outlets.
Yes, we have one at Chippy Gardens, right next to Daily Scoop Ice Cream Shop. You know that row?
Next to the ice cream shop.
Of course. I'm
That
human too.
is so perfectly.
I think
yeah.
it's strategic, you know.
I love it. It's a great neighborhood. And then I have another branch at Novena at the Royal Square. So I'm closer to where my referring dentists are, like my surgeons, my ENTs. So we
okay.
work very well together. So we have
Okay.
2 branches. Yes.
I'll come see you after ice cream.
Oh, for sure.
Thanks.
I meet you at ice cream first.
Okay, awesome. I like your style. Hi, everyone. Thanks so much for joining us here on Facebook Live. Send us any questions that you may have for Dr. Poon. Anything? Anyone else? Last parting words?
I just want to ask, the other son I have.
Okay.
Okay, so he's 7. He's got, he's a wonderful kid with Bugs Bunny teeth,
Okay.
Oh,
which is very
cute,
endearing.
cute,
Yep, cute.
But you're saying just be aware of that, right?
Yes,
because
correct.
you're saying, what was it? What was that amazing statistic?
6 millimeters. If
Yeah.
it sticks out more than 6 millimeters, if you fall, you're 4 times more likely to chip, break, or damage your teeth.
Oh wow.
Okay, so when should I start looking at that now? I mean,
7 years old,
yeah.
please see an orthodontist
Okay.
to get it screened, get it checked. Be careful of certain sports that are higher risk, you
Okay.
know, gymnastics,
Okay.
and things like that. If you're going to play rugby, wear a sports guard.
that's
Right.
important,
Yeah.
right? The new
Yeah.
sport. Okay,
If
no,
not,
that's
change
interesting.
the sport. Library is a very good sport, huh? Library.
Being
Library.
the school librarian, yes.
Read up on dentistry.
Yeah, he can't.
You'll
he
have a
can't keep
career.
quiet. That's the problem.
Oh my gosh.
Here's the fun part because we are neighbors
Yep.
back then. And sometimes, she would tell us about all these cases that you studied,
Oh,
that
yeah?
you went through. Oh my gosh, you really mind open, right? So, what are some unusual ways that orthodontics can help a person's teeth?
Okay, so example, A common one would be, hey, I might have lost a tooth. I bit on a peanut, or I cracked a tooth on a chili crab, and the tooth needs to be taken out, right?
Yeah.
Instead of jumping straight into a dental implant to replace it, there are many patients who are very surprised that they can use orthodontics, braces, Invisalign, or some clear aligner system to actually straighten the teeth and close it up. So you get 2-in-1, right? Don't need to do an implant, but yet you get straight teeth. Why not? They don't know that.
And it's less invasive.
Yes, exactly. You have natural teeth forever versus having something that's artificial that you have to maintain. Sometimes it can't be helped, true. But why not consider the option of actually tidying up at the same time? Take the opportunity, right? To do the housekeeping.
Okay.
Right? So that's something that people often don't know that's an option.
What about the the conception that people may have that, it's going to cost so much money?
So if you think about it, if you're using your own natural teeth to replace, example, a missing tooth, you already offset the cost of replacement. That's one.
Yes.
Secondly, it's the cost of maintaining something that is artificial.
Yeah.
Sometimes things break down. Implant technology has improved leaps and bounds.
Yeah.
And you can keep a good implant for decades. But there's always going to be this worry that something happens, I've got to drop everything and get the implant checked out. It is not wrong, but if I have an option of, using only natural teeth, I would.
What's already there?
That. Yeah. And you get a straighter teeth in front anyway. Why not? I need to create space to straighten up. Why not?
Yeah.
It's already there.
How come we don't hear about this more often?
It's an option. There's something that you can discuss with your orthodontist if that happens. Yes.
Okay.
So find an orthodontist. There's one in front of you. Quick.
I know. I've just never, I've just never, been in the pathway of an orthodontist.
But we have many, many strange and wonderful cases. It will never end. Like teeth that stuck. I have a kid fell, the tooth was pushed into the nose.
Oh my word.
Unfortunately, it happens. And then I use orthodontics to actually bring that fella, that tooth up there, bring it down slowly with time. So there's natural teeth. You don't need to have a missing gap forever.
My husband, he fell on his face. Someone pushed him. I think he fell on his face when he was a kid, in primary school. And that actually pushed his nose aside. And that resulted, and his teeth is forever bruised. Perhaps he should come see you. It's like complete bruising on his teeth. It hasn't gone away. I don't know whether that's something you can look at.
We can have a look at it together.
But it resulted in sleep apnea.
I see.
Because the nose was out of shape.
Right,
yeah.
That's right.
And
so it's all connected.
He didn't get the right attention till he was in his 40s, I think.
As you say, address it early.
Yeah, correct.
Yeah.
Well, maybe back then they also didn't have, the knowledge or experience.
Could be.
Now it's very well
and the
developed.
technology.
Yes, that's true.
Last time, no 5G phones, only pagers. You know what I mean?
Yeah.
Maybe no pages also. Last time is postcard and letters.
You were saying that your oldest patient, so it's never too late to come look for you, because earlier on off air you were saying that your oldest patient is 81, and there's still opportunity for you to rectify things at that age.
Yes, that's right.
It's never too late, right?
Yes.
Yeah, she wanted to do it so that she could eat or chew her food better.
Yes. She lost teeth over time. They move all around. She couldn't put any form of either denture or implant. Nothing could go in. So she can't chew, she can't eat. So she's very sweet. She says, you know what? I am not trying to be Mrs. Singapore. I just want to eat.
Yeah.
So I say, okay, fair enough, right? So let me move things around, so that you can have something decent and usable to eat. And that's what we did.
Okay.
Yeah.
Last question. My mom had a fall. She's 83. Her tooth was shaky. We thought it was going to fall out. It didn't. It's still there. It hasn't fallen out, but it's still kind of shaky. So she can't chew. So I say, let's have rendang. She's like, I can't chew. So what would you say to someone like that?
I think the first thing to do if you have a very shaky tooth that, you can't eat, please see a dentist, see an orthodontist, work together with a team of dental professions to try and sort it out, because I like to eat. Yeah. You know what I mean? So if you can't, I think it's a bit miserable.
Yeah, so poor mom, she can't bite into things like a sandwich or an apple that
Yeah.
anymore. Because she's afraid it's just going to go flying out.
If not, they eat from the side, which is also very weird.
And maybe do it now, right? Like Dr. Poon has pointed out, save your natural teeth instead of putting in an artificial
one. She's 84.
One.
She's always been very proud of her teeth.
Well
That's
done.
perfect pearly whites.
Well done.
And at the other end of the scale, my son can't stop either losing or damaging one of his twin blocks. And it's very frustrating.
I see.
Because he's constantly fiddling or taking it out. And he's lost one as well.
No.
Namaste.
Namaste.
Very, very annoying. But anyway, thank you. This has been really illuminating.
Yes.
I think the key thing for me was that got to keep your teeth maintained with a retainer.
Oh,
At
maintain
night.
with
We
a
didn't.
retainer.
I don't think many people know about that. That's really
Yeah.
interesting.
Awesome. For me, it's a 7-Eleven.
7-Eleven.
Yeah.
Yes, that's good.
Kids. Yeah.
Thank you, Dr. Kee. Lots of key takeaways.
We just want to mention to you, you want to head on over to their website. It's mybracesclinic.com, or you can find out more at their Instagram, which is mybracesclinic. Please go and check it out. Get in touch with Dr. Poon. Really, she is just so comforting. I love having my checkups with you.
Oh, thank
I know we're gossiping about other stuff and catching up, but
That's
you can
probably
see,
the real
she's
reason.
so lovely.
Isn't that half the battle as well? When you're fiddling with people's teeth and mouths, it's the how you come across in the bedside manner, isn't it? It
Yes,
makes
of course.
put someone at
Yes,
ease,
correct,
isn't it?
correct, yes.
It's really. I think that's the psychological part, especially with kids.
All
It
my
really
kids
is,
love
right?
seeing
Yes,
her.
of course.
Perfect.
They love her clinic.
Yeah.
Dr. Poon,
Yeah.
when someone comes to you and they have bad breath, what do you do?
Be very diplomatic. That's first and foremost, right?
What do you say?
What an interesting question.
Yeah, I know. Well, luckily, I don't get that very often, to be fair, because my the patients that come and see me, they're usually taken care of or worked out with a dentist,
Before they
periodontist,
see
or
you.
hygienist.
Okay.
So they are nice and clean before they see me. But if they come and see me with, not so nice smelling breath, I would gently nudge them. You know what? I think it might be time to see a dentist or a hygienist. You know what I mean?
Yeah.
Ah,
Halitosis isn't
That's
fashionable these
correct.
days.
it's
correct.
these
Have a mint,
days.
have a
Don't do
100.
these.
Just kidding. We love you, Dr. Poon. Thank
Thank
you so
you.
much.
Thank you.
Thanks, everyone on Facebook.
Thank you very much for
Thank you,
having me.
guys.
Thank
Our
you.
pleasure.
Good times. Greatest hits.